Can you make sure not to put me back too far? Okay, yeah, that's enough. No further. And you know that suction thing that you use? Like, can you just not put it in the back of my throat? Like, you gagged me with it. Why do you guys even use that thing? You know what? You might as well just even let me do it. You guys don't really know how to use it anyway. You might as well let me hold it. I'll hold it. I'll do it myself. And then when you polish, use that mint, not the peppermint, that disgusting mint that's like really spicy. I don't like that one. I want like more of like a wintergreeny one. You have a mint like that, don't you?
Okay, so let's just assume that people like that aren't intentionally trying to, right? They're not trying to come in to ruin our day. That's not their intention. I mean, yeah, you have the select few people that just are difficult for the sake of being difficult, but 99% of the time, that is not their intention. So we're going to give you some actionable tips and tricks for how you can deal with these difficult patients.
At the Dental MVP, we use science to teach people skills to you, the dental professionals. Do not forget to subscribe to our channel, the Dental MVP, and don't forget to hit the bell so you never miss out. We all like to think that we are rational beings, right? Well, the truth is that that's not the case. We really are irrational human beings. We always have things that we believe in, things that we do that don't make any sense to other people around us, but we do them anyways. So everything we do doesn't have to make sense to the people surrounding us. So all the time when your patients come in and they say that they can't be laid back, and you're thinking in your head like, how do you sleep at night? They're irrational human beings. So remembering that first and foremost is the first thing to do when you have one of these difficult patients in front of you. We really want to make sure that we remember that they're not trying to be assholes. So even if you use the mantra like, they're not trying to be an asshole, they're not an asshole. Go ahead and say that to yourself. Whatever gets you into the right mindset to be able to take this person in and not to be judging them. Then we can take some steps to really dive a little bit deeper to understand where they're coming from and how we can get through this damn appointment.
The first scenario that we're talking about is those patients that just have a lot of needs. So they come in and they're like, oh, don't recline the chair too much. I need a pillow. Can I hold the suction? I need to diffuse aromatherapy while we're doing this. Like, they just have a lot of needs.
Can you wear the blue gloves, not the green ones? I hate green.
And we tend to get really tense in those situations when someone comes in and starts dictating how something is going to be done to us. So our advice for this is to try to take the path of least resistance. We are not rational people. So if we put the effort into trying to make them see our side, like you can lay back because you sleep laying down in a bed at night. All that does is it creates tension. So when we try to pull them into seeing what we believe and what we want them to be able to see, it really just makes them dig in their heels, and then they get more specific on what it is that they need and how it's going to be done. And it just creates a tension dynamic. So taking the path of least resistance, allowing them to identify what it is that is comfortable for them for the appointment is a great way to try to diffuse that. And you can slowly work towards what you need throughout the appointment. Yeah. Like if they say that they can't be reclined, you can slowly recline it as you're telling that they're getting a little bit more comfortable. But the idea of going from seated to just laying them straight down and being like, yep, you can do this. It just doesn't work.
Yeah. Our patients know their bodies. We all know our bodies. And we've all had that time. Like, think of a time where somebody said like, oh, you're fine, right? Mm-hmm. Where you explain yourself. You're like, this is really uncomfortable. I don't like this. I don't like that. And someone says, you're fine. Like, you know that feeling. Yeah. And we don't want to give that feeling to our patients. So saying you're fine, you're wrong, those are the same things. You're fine, you're wrong is the same thing. And we never want to say you're wrong to our patients. We want to be compassionate and show compassion to them. So if they're saying the headrest is uncomfortable, say, well, how can I make it more comfortable? If they're saying like, I hate that water thing, well, how can I make you like it? Like, what can we do to make you more comfortable throughout this appointment? Don't be afraid of the difficult patients. Go ahead and take that path of least resistance and see what can we do to make this a good appointment for you.
And then if you toss in those preferences into the note, it really helps you for future appointments if you can anticipate it. So it's always easier for me if I know what the situation is going into it. I can say, okay, we're going to have a pillow ready for this person.
The pillow patient.
I'm going to be standing during hygiene to be able to start out and make it a little bit easier for them and for me.
Mm-hmm.
As long as you can anticipate that, you can usually put yourself into a better mindset where at least you're not feeling off guard where you walk in and they're like, by the way, I just wanted to let you know. And it also honors what it is that they like to do. If when they come into the office, you already know what it is that they prefer. It makes them more comfortable, which makes them less likely to get super particular with all of the other things that are about to happen.
If you say it first before they do, they've already let their guard down. So if they walk in the room and you say, I know you don't like to have your chair laid back too far, so I'm going to make sure not to do that to you. They're already like, oh, okay, I don't have to tell her. And then you might even get an extra inch or two out of it because they think that you know exactly where they want it to be. So letting your patient take that guard down, be the first to say, we know what you need. And that really helps with these difficult patients.
Or if you are getting a patient where in the notes, it talks about how difficult they were. And it's like, patient doesn't like this, doesn't like that. When they come into the operatory, you can really put it as simply as saying, like, I know that dental appointments tend to be a little bit more challenging. What can I do to make this more comfortable? And give them just the opportunity, the floor to be able to say what it is that makes them more comfortable. And then just honor it and go with it. It diffuses the situation where you don't run into any of those moments where you go to flop them back and they panic. And then you're
and the entire
on the
appointment is
spot.
ruined after that.
Yeah.
Yeah. We don't want those moments.
So go with the path of least resistance and honor what it is that makes your patient the most comfortable in the dental practice.
The next situation that we always run into, unfortunately, are those patients where there's more of like a behavioral issue or a personality that we just don't align with. You have that patient who comes in and they're like white knuckling the chair. They're super anxious. You can't do anything right. And everything is wrong. Or you have the patient who's just like, can you not talk to me this entire appointment? Or don't do this or don't do that. And it's really hard to align with that person. That's the next type of situation that we run into all of the time.
Yeah. And with those patients, really, it is searching for the underlying need. Like, what is going on with them? Because typically it's not you. Like, the problem that they're having isn't a you thing. It's not that you're not treating them in a way that's appropriate. It's not that you're not providing quality care. It more so is that they have a barrier to being there in the office, whether it's something that's happened throughout their day, if they're just really stressed out because of whatever that has happened and you just happen to be the person that's getting the brunt of it, or if maybe they come into the office and they have a lot of dental anxiety. So they get really uncomfortable during the hygiene appointment or the restorative appointment. And then at the end, their personality changes. They're like, oh, okay, like now we can have a conversation.
Oh, we've all had that person.
They're able to relax.
Like, where was this person 10 minutes ago?
Yeah. We've all experienced those types of situations, and it is baffling. So for these patients, we really have to pause and be able to search for that hidden need. And there's some questions that we can be able to ask. You know, we can also just directly approach the patient and identify an emotion. So it seems like you're really stressed out today, or it seems like you're really frustrated. Is there anything that I can do to help? And a lot of times spotting that emotion and communicating it is really disarming on its own.
Yeah.
Because people have to check themselves and
but
say,
make sure you ask questions to really figure out what that emotion is, right? We don't want to just be like, wow, you're really angry today. You seem really frustrated today. And they're not like, that's not the word that they would use, because that can also really escalate a patient right there. Yeah. So if you say, you seem really frustrated, and they're like, I'm not frustrated, I have anxiety. You know, like then the entire appointment is ruined from there. So make sure that you ask questions to dive deeper into exactly what's going on. So tell me about your day. Tell me what's going on here. Oh, you seem to be, you know, uncomfortable. What can I do to help you? Is there something that I did to make you feel this way? Really try to figure out where they're coming from. And if they say, no, it's nothing you did, I'm just having a crappy day, well, then you have the opportunity to connect with the patient and say, well, tell me about it. You know, go ahead and take a minute and stop and allow them to just decompress for a moment, because we are human beings. And a lot of times we just need to tell someone. So if you just had a horrible conversation in the car ride all the way to the dentist appointment, and you haven't gotten to call your girlfriend or call someone or tell someone about this obnoxious conversation you just had, and you're holding it in, then you're going to be reacting that way. So be the person that they can just kind of relieve some stress from. And then hopefully this will take that guard down and you'll have a better appointment.
Yeah. A lot of times we joke that we are a patient's therapist, and a lot of times it's true. And the nature of it is that we're people, we want to have interactions. We want to be able to talk about what's going on. If there's something that is stressful or underlying that's happening, even just having another person acknowledge our emotions, to be able to validate them, to be able to delve deeper into having a conversation is completely enough to be able to disarm the situation and put it into a direction that's going to be more successful for both you and the patient.
Okay, we've all had the patient who uses the term, can I just talk to the doctor? You know, where you're going over treatment with them. Maybe you're at the front or you're a treatment coordinator and you go to the fees and then all of a sudden they go, yeah, can I just talk to the doctor about that? Where you're like, I mean, nothing's going to change, right? He's recommended the treatment or she's recommended the treatment. Nothing's going to change pricing wise. So talking to the doctor does nothing for you. Or the patient on the phone, you're going over their overdue treatment or their overdue payments and same thing. Can I talk to the doctor? You're like, what is this? Can I talk to the doctor business? I'm the person that you need to talk to. Why is it that you want to talk to the doctor? Like, they're not going to do anything for you. And then you spend the rest of the time at the appointment or on the phone trying to convince them that you are the appropriate person that they should be speaking to. And the doctor has nothing to do with this conversation. And it is so frustrating. How do you deal with a patient and those difficult conversations like that?
Yeah, these are tough because you have the patient that comes in that wants to only see the hygienist that's been there for the longest amount of time.
Too, yeah.
Or the new associate dentist, but the patient doesn't want to see them because they want to be with the dentist that's been there practicing for the longest amount of time. And it just feels like it discredits you. Mm-hmm. Like the education that you have or the experience that you have isn't important. So a lot of times we try to go at those situations by validating our education or our experience, our position in the practice, what it is that we know, what our role is. And sometimes this can work with explaining to the patients because sometimes they just need clarity. But there are other situations where this truly is just a belief. Mm-hmm. The person has been conditioned to believe that the most amount of years of experience is the most effective provider that they could see. And really, it's a loss to them. So we have to accept that sometimes that just is their belief. So if that's who they want to see, okay, we can put them in their schedule. The reality is that they're limiting themselves. So they're making it to where they're only getting one perspective. They're not going to get various opinions. They're not going to get various perspectives. They might not even be talking to the person that can give them the true solution.
Right.
The person that's going to be able to address the questions to the best of their ability. But a lot of times we just have to accept that that's their belief. That's the way that they've been conditioned to think. And we don't want you to feel pressured to have to validate your self-worth.
No.
Your education, your experience.
No need for that.
But it's tough. It makes it tense because we get really, really offended by this because we all want to be liked. We all want people to know that we know things, that we're successful, and that we have skills. But try not to be defensive about this. Just accept that they are limiting their own perspectives that they're going to be able to achieve.
Yeah.
And just accept that.
Just accept it. Okay, now if you're struggling after going through these three different scenarios and you have that situation where the patient is in front of you and you're not really sure how to approach it, or you're even having a hard time calming yourself down, seeing their side, respecting what their decisions are, this might be a good time to look outwardly, right? Look for one of those team members that can help you. Go get some advice from them. And beyond that, what I would highly recommend is not going to the person that you're actually the most comfortable with. Because we like people who are like us, and they might have a shared view on this and a shared opinion. We want somebody who usually has an opposing view and opposing opinion on situations. Go to them and say, what would you do in a situation like this? What should I do when I have this patient in the chair next time or right now at this very given moment? That way you have a different perspective on how to handle the situation. And you'd be really surprised the things that you can learn from your team members as to how they would handle the situation.
Yeah, we're really looking for someone who's going to play devil's advocate in this situation, give us a complete third-party perspective of why someone might be reacting or behaving the way that they're behaving. And then we want to find someone who's going to give us some solutions or a solution base. So we don't want to use it as a vent session, although we all might need a little vent session here and there after something that's frustrating. But really getting a direction of where we can go, how we could proceed next time. And maybe it involves seeing a different provider or trying a different approach or whatever it may be.
It does feel really justified when someone else says that. When you're just like, instead of saying, I never want to see this patient again, to kind of go through from a solution-based approach and have a conversation with a team member, and for them to say, you know what, I think it's best for you not to see them again. You're like, yes. It is so justified when someone else can see it.
I was like, well, and sometimes personality-wise, it has nothing to do with how good of a person you are, how effective you are. Like, maybe the issue is just the personalities don't align.
Totally clash.
Like, maybe you're really extroverted and they're really introverted, and it's just a big clash and is more overwhelming than it is effective.
I mean, think of a time when you had a patient that you loved and another assistant, hygienist, front desk, dentist hated that patient. They're like, oh my God, I hate this person. You're like, oh my God, they're one of my favorite. What do you mean? So we've all been there before where you just, the personalities click or they don't click.
Yep. They might work better with someone else, and that's okay.
That's totally fine.
And then the next thing is you got to decompress.
Oh yeah.
Once you've gone through a situation like this where you have a lot of tension, a lot of frustration, you probably had a lot of internal dialogue throughout the appointment, taking a walk. Just, take a walk, take some deep breaths, really give yourself time to process what just happened and be able to move past it so it's not affecting the rest of your day.
Talk to someone about it, because we can't hold those things in either. I mean, try not to make it a crazy vent session, but definitely talk to someone about what happened, what's frustrating you about the situation so that you can move past it. And then, go for a walk, read a book, whatever you do to relax yourself, go home and take a tub, whatever it is. Do that so that you can relax and kind of come back to that zone that you need to be in to get the rest of the day done.
And then congratulate yourself because you just made it through a really, really tough situation.
That's not easy.
No, definitely not easy.
Dealing with difficult patients and coming out on the other side is huge. So definitely give yourself a pat on the back, congratulate yourselves. And when that appointment is done, remember, it's done. It doesn't need to come home with you. You don't have to sit and dwell on it for the rest of the day. It's over. The patient is gone. The appointment is done, and you can move on. So congratulate yourself, deep breathe, and move on.
So we want to know, what techniques do you use in the practice to deal with difficult patients? Now, do you have a team member that's had a tough time dealing with a difficult patient, or maybe they shared a story with you recently about something that happened? Make sure to share this video with them as well.
Do you have an actual situation that you're running into that you would love to hash out with the Dental MVP? Make sure to send us an email at info@thedentalemvp.com, and we would love to go through it with you. Did you like this video? Make sure to like it, and don't forget to subscribe to the Dental MVP.